At one point in our life, there's a good chance we're gonna have to go to the hospital or to the doctor's office. So no doubt, with all those people going back and forth, you're bound to have some interesting experiences. I found quite a few facepalm stories, and some that were just funny. So without further ado, let's go. A guy comes into the emergency room by an ambulance. He has burns on his lower extremities. His shoes are charred, and the bottom of his pants have been burned away, but his skin isn't so bad. He was trying to use a propane power weed burner. Think something like a flamethrower. Well, this thing got a little out of control. I could smell the alcohol in his breath. So I asked him if he's been drinking, and he looks at me straight in the eye and he says, "No." I just about got drunk standing next to him. Well, it was a once-in-a-lifetime opportunity. I couldn't help myself. Straight to his face, and as professional as possible, I said, "Sir, liar, liar, pants on fire." The paramedics, they all turned at once and ran out of the room because they were laughing so hard. The patient just stared at me. He was so drunk it went over his head. As a surgeon, I was doing a varicose vein surgery for a very posh middle-aged woman. She had a very cut-class accent. There are some anesthetics that we used that would sometimes induce hallucinations, either while you're going under or coming out. I've heard some funny things. Anyways, this lady was in recovery, and she was coming out of the anesthetics. The team was around waiting for her to wake up, so that they can listen if she gags a little. If she does, that's when you remove the tube. Well, she starts to gag, and we removed the tube. Then she smacked her lips and loudly said, in her incredible accent, "That's the best bit of cock I've had in years." The whole recovery room fell about laughing, but luckily, she didn't remember it. When I came out from having my wisdom teeth pulled, I apparently shot up, and I looked at the doctor in the face, and I declared, "Charlatan! I demand you return my teeth! They are mine, and I will choose where they are spent." My dad couldn't stop laughing, because I wouldn't leave without them. When I woke up at home, I asked my dad why I had my teeth in a plastic bag on the table. Well, he told me everything, and promptly started calling me the Molar Lord for the rest of the night. I went to the ER for a painful ingrown toenail. I was going to have them remove it. I was sobbing, and I was gagging, absolutely petrified, the works. But my doctor knew how to calm me down. He said, "Don't worry about a thing. I just looked up how to perform this on YouTube, so we're good to go." One day my patient announced that she had good news and bad news. She said the medicine for her earache worked. I asked her what the bad news was. She said it tasted awful. Since she was feeling better, I didn't have the heart to tell her. That's why it's called eardrops. I'm an ER doctor. Once I had a 20-year-old and his girlfriend. They came in at 2 a.m., freaking out because something has torn his throat open. He seemed fine, no blood, breathing fine. He had his mouth open, and I saw nothing. I didn't want them to lose confidence in me because something clearly happened. So I'm looking, and I'm looking. There's nothing wrong. Finally, I say that everything looks okay. What does he feel or see? He goes on to say, "I don't feel anything, but it's right there." I ask where. I'm looking around, and all I see is his uvula. Somehow, this kid had gotten to the age of 20 without ever noticing his uvula. His girlfriend was also horrified. I told them both that it was normal. They did not believe me, so I told them both I was about to blow their minds. And I showed him that his girlfriend had a uvula too. Their minds were blown. Another life saved in the ER. An older lady was brought into the ER. She was barely conscious. Her husband was accompanying her. She had a very thick Italian accent, and she told the doctor that she was dying. She had complained about feeling tingly and having a dry mouth prior to passing out. The doctor set the husband down, and they did a history. There's no serious medical problems. She was very fit. In fact, she spent the morning cleaning her son's bar. She often did that on Sunday mornings. Considering her age, they took the symptoms very seriously, and they began to run tests to see what the problem was. Well, the son came in to visit his mother. On the way there, he dropped by his bar. He noticed that his mother had helped herself to some treats prepared the night before. The son, the apple of his parents' eye, had to explain to his father and the doctor that the treats that she enjoyed were space cakes. And apparently, she really enjoyed them because she ate quite a few. They then had to sit down and tell this elderly lady that she was not dying. She was in fact really stoned. Fortunately, she was still high enough to see the humor in it. I went to the doctor because of anal problems. The doctor put his finger up there to check if everything was okay. I made a slight noise, and he asked if I was okay. That's when I said, "That's nice," instead of "That's okay." A woman came in for her baby's checkup at the 6-month-old mark. She had what looked like chocolate milk in the baby's bottle, so I started to explain to her that she shouldn't be giving the baby chocolate milk, at which point she interrupted me and said, "Oh, that isn't chocolate milk, it's coffee. He just loves it." A woman had a gynecological appointment one afternoon. Before leaving, she used a little feminine deodorant just in case. When she got to her appointment and is assisted up into the stirrups for her pelvic exam, the doctor takes a quick look and he says, "Why aren't we fancy today?" She did not use her feminine deodorant. She instead accidentally grabbed her daughter's glitter hairspray. I'm a dental hygienist. I had to explain that brushing your teeth with Comet, yes, the cleaner, was not a good way to clean your teeth. And this was to a 40-year-old woman. I also had to tell a woman that painting her teeth with white fingernail polish was a bad idea. I asked a patient complaining about dizziness if she's ever been diagnosed with vertigo. Her daughter chimed in and said, No, she's a Libra." I then laughed hysterically at the awesome joke. Unfortunately, she was dead serious. When I had my colonoscopy, I told my GI doctor, "Wow, now I know what it's like to be a Muppet." He had to stop for a minute and regain his composure. I had a patient claim that amputations run in the family. He said that was the only reason why he needed his legs taken off. He was adamant that it had nothing to do with uncontrolled diabetes, or his enormous or continual sugar intake, plus his absolute refusal to use insulin, and rejecting treatment for the giant infected wounds on both feet. A friend of mine mistakenly called her gynecologist instead of her dentist, so that she could make an appointment. Well, she started out the call by admitting that she was overdue for a cleaning. I got to doing rotations at an orthopedic floor. It was in a big hospital in a rural area of Southern California. I was doing my rounds and I saw a patient out of bed. She was walking around following a knee replacement. She had a cane in her hand and she was carrying it like a soldier would carry a rifle. I asked her what she was doing. Well, she replied that she thought the cane was for pushing people out of her way, since now she was handicapped, because apparently it wasn't for helping her walk on her post-op knee. A guy came in on a wheelchair. I asked him if he had any medical issues. He said no. I asked him why was he in a wheelchair. Then he went on to say that he had a degenerative neuromuscular condition. Oh, and also type 2 diabetes. Some guy was dancing in skin-tight leather pants. He was doing this during the opening of a new nightclub. It was really hot inside, with a huge crowd. This guy ended up fainting, and he was taken to the ER, where his pants had to be cut off. This revealed that the guy had a length of pepperoni in his crotch. He had it taped to his thigh. The ER staff got the giggles, and they had to leave the room. At one point, one of them finally said something like, "We've got to get back in there. We got to deal with that unconscious patient." So finally, they were able to calm down and return to their professional duties. I work in anesthetics, and it drives me mad how many patients say that they're allergic to antibiotics because it gives them the trots. No, That's just a side effect. The anesthesiologist comes in and asks me not to ask the patient about their allergies. I was puzzled about this. I asked her why. Because the patient claimed they were allergic to oxygen. Yes, you heard me right. Oxygen. Well, she was a fun patient. The day after I had surgery on my leg, a nurse came into the hospital room. She had a box in her hand. Then she said, "Are you ready for this?" So I asked her what it was. "A fleet enema. Didn't your doctor tell you about it?" I said no, horrified. Well, she did recheck the order, and she came back and said, "Whoa, it said feet elevated." My favorite story ever told was from a colleague. A patient came into the A&E. They had abdominal pain. As a part of the work, they took an x-ray, and it showed the problem clear as day. The colleague had to proceed to remove from the patient's rectum an 8-inch replica of the Nelson's Column. It's the statue in the center of Trafalgar Square, which is in London. On showing it to the patient, the response that they gave was, "Oh, that's Nelson. He lives up there." A teenage male patient came into the clinic with his girlfriend. He was growing breast with milk production. It turns out that his girlfriend was giving him female hormone birth control pills for extra protection. I work at the eye doctor. I regularly have people come in for an eye examination because when I take off my glasses, things become blurry. Often these aren't passing comments. This is the main reason for the visit. A 32-year-old grown man asked me if the hot spells that he experienced at night meant that he was going through menopause. I once had a daughter of one of the patients march up to the nursing station and slam down the vitals on the desk, and she started yelling at me, "How dare you say my mother stinks?" I'm just utterly puzzled by this, because no one has ever said anything like that. We asked what the daughter meant, and for her to explain it. Well, she grabbed the chart, and she points at the row of BOs. Then she shouts, "Here you even have the nerve to write it down!" I explained the BOs means bowels open, not body odor. Well, I stayed professional until I was able to escape to the staff room, where I proceeded to laugh my head off. My mom's an ER nurse. She said once she had some crazy lady come in. She complained that she was having a whooping cough, because whenever she coughed, she followed it up with a loud whoop. I was a medic in the Navy. I had a Marine come in because he swallowed a rock. I asked him why. Why would he swallow a rock? And this is what he said: "I was hungry." I work at a pharmacy. This old guy came in with an inhaler. He had it prescribed by his GP because he had allergies to his new dog. He came back to the pharmacy and said that he was still completely breathless around the dog, despite using the inhaler 4 times a day. We continued to ask questions to find out why. It turns out he was using it 4 times a day, but he was spraying the dog with it. Thank you very much for joining me for this edition of, I guess you can call it Fun with Facepalm, because a lot of these fit. Some of them were just funny that I decided to add in. If you want to check out more of those stories, I'll have a link down in the description. There was a lot of stories in there. I just included the ones that stood out to me. You might find some that you enjoy that I didn't include. I want to give a special thanks to my patrons. Your help is greatly appreciated. If you want to become a patron, just follow the link in the description. Well, thank you very much. Make sure to hit that like button and share. Well, until next time, this is Dallas, signing off.